Hey everybody, so we're gonna keep moving right along. This next HCS guide is gonna be on treatment plans. Okay, so all of our patients should have a treatment plan completed, and we are targeting reason for admission and medical conditions. Okay, so we've already done this, right? We said we were gonna build our treatment plan. You want to come down here to your blue panel here, select items, edit problems. There you go. On your patients who have had an intake assessment completed, you're going to get some perspective problems as they relate to your patient. So if you guys remember when I put my patient on precautions, I put SI and assault. So it already gave me the treatment plans for SI and assault. So I'm going to go ahead and select danger to self, add to problems, danger to self related to thoughts. Oops. So I'm just going to put why he's a danger to himself. So thoughts of SI as evidenced by patient verbalized plan and intent, right? Something basic, quick and easy. You want to change this to psychiatric, inpatient level of care. And then you can just keep adding danger to others, assaultive behavior, add to problems as related to increased aggression. Increased aggression as evidenced by, we do the Brossett, so you can put that in here, Brossett score of, 16. Classification, psychiatric and inpatient. My patient has hypertension. We said that earlier, so I'm going to add. Now, these aren't like our treatment plans where we actually had one for elevated blood pressure, stuff like that. These are slightly worded differently. These are the ones that came to us from corporate, so the ones that we're using. So you could go to medical and kind of scroll down. For those of you that remember doing care plans in nursing school, these are much more similar to the ones that we did in nursing school, where it was all symptom-based treatment plans. So you will, go down here and pick the one that applies. So for hypertension, I have been doing cardiac function impaired, or sometimes I will do increased vascular resistance related to, diagnosis of hypertension as evidenced by elevated blood pressure upon admission. You can get fancy and you can put, elevated upon admission, maybe his blood pressure was, I don't know, 186 over 102. That's probably too high. So 90. Medical, inpatient, and we're done. You hit save. So just like that, you have done your treatment plans on your patient, and it didn't take us very long. Now, ideally, the next step will be for you to come in and add the treatment interventions. So how you do that, you want to open up your treatment plans. You would click on the treatment plan, add goals and interventions. Long-term goal, there's nothing there. We can skip that. The therapist will come back in and kind of plug that in. But our short-term goals is what we're going to pick for our patient. So patient will identify, 2 triggers for rapid decompensation that lead to rehospitalization. Okay, I picked at least one. My interventions, you want to pick anything that relates to nursing. So, a quick scroll, the RN will provide medication education. Okay, we'll apply that. And then, maybe pick a provider, will provide medication, will provide medication management. Provider will order and titrate medication, provide patient with coping skills. That's usually not a nurse. So we could add provider, we'll have an individual session with patient to educate symptoms of management. I'm going to add those goals. My short-term goal is going to be for less than a week. So today is the 22nd. I'm going to pick the 28th. Patient will identify 2 triggers for rapid decompensation that lead to rehospitalization and increased thoughts of SI, because that's what this one is for. I'll provide medication education as needed. The provider will talk to the patient about his depression. You not make it all caps. And he's gonna meet with him, as needed, but daily. Interventions are done. Same thing, danger to others. I'm gonna add my goals and intervention. So a long-term goal, we do have one here. So patient will, eliminate aggressive interactions. Pick a short-term one. We'll put that he's going to have behavioral strategy, will not get into a fight while he's on the unit, whatever the case may be. If medications, of course, you could always do those, are a little bit easier. So interventions that we're going to do, again, the first thing I always do is I look for anything that's RN. There's not an RN one, so now I'm going to look for my provider one. So provider will order medications and titrate the dose, and the provider will educate the patient. I'll go ahead and pick those. My long-term goal is a week, so you can pick a week. My short-term goal is less than a week, and we want to say he's going to identify 2 coping skills. So we'll identify 2 behavioral strategies that can be used to manage symptoms when having thoughts to, harm others. Okay. And then it says here, we'll provide orders, we'll order medications and titrate in order to. The reason we want to reach therapeutic, oh, I'm sorry, I'm rushing. Reasons reach therapeutic level, and then he's going to do that as needed, and then the last one again as needed. So pretty simple. Add your goals and interventions, you're done. Now for our hypertension, that one we know all the answers to. So we want to make sure we pick a long-term goal. We want to make sure we pick a short-term goal, and then we want to pick anything that we're actually going to do. We're going to educate our patient. We're going to administer the order. We're going to monitor for side effects. We're going to educate the patient. So we're going to add those goals and interventions. This is for a week. This is for less than a week. And then we just start plugging in everything. So I always pick as needed, unless it's a medication, which you do need to know how often the medication is being taken. I know this is a little bit more time consuming, and we don't always have that, the opportunity to do that, but we do need to put in treatment plans for our patients. Medical treatment plans are almost hardly ever put in there unless I've already reached out to the nurse and they put them in afterwards. But we really got to get better with this. This is a Joint Commission and CMS standard. We have to show that we're actually documenting to our patients' treatment. So please, 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 please make sure that you are putting in our medical treatment plans. If your patient has a fall, a UTI, they come back from the hospital, we've got to put these in there. They do not take that long, I promise you. So bringing it back, lisinopril, we'll administer lisinopril, gets it once a day in the morning. We're going to monitor their blood pressure daily. And I'm so sorry, and PRN, and then we will educate them as needed on why they're on their blood pressure. And it will alert you when you forget something. So I forgot something right here. I forgot to add something there. Hit save, and I'm done. That's it. That's all you got to do for treatment plans. I know it's time consuming, and I know the mix of everything else that we're doing, but please, if you get cottage F later, maybe later in the shift, if it gets quieter, at least put the problems in there, so we know that they're there. And I don't mind going in and adding, and Ms. Tina's doing a lot of audits on F, but please make sure you're adding in your treatment plans. The interventions and the goals and interventions, we can take this in baby steps, put in the treatment plan, and then we'll work on getting the goals and interventions in there. But we have to get them in these charts because they're just not existent. A little bit different, like I said, they're worded a little bit differently now. They're not as clear cut as they were prior to going on to HCS, but pretty straightforward, okay? So you guys, let me know if you need more training on this. We can talk about them, but we've got to improve how many treatment plans we're getting in our charts. Thank you.